Live with coverage you trust. This is NBC 10 News at 11.
But first, the night team is on a health alert. The Rhode Island photojournalist who is diagnosed with Ebola while working with NBC in West Africa will be flying to a hospital in Nebraska for treatment this Sunday. Hi, everyone. I'm Dan Janey.
And I'm Patrice Witt. His family spoke with NBC 10 today about their son and what's next. The night team's Brian Crandall is live with the story. Brian?
Well, Patrice and Ashoka Mukpu's parents say he sounds good and his symptoms have not gotten worse, but they are worried, realizing their fears when their son told them he was heading into the danger zone because he wanted to help. And his father, a Rhode Island hospital doctor, says his son knew the risk and thought he was taking the proper precautions.
Fear. Absolutely fear for my son.
The fear for Ashoka Mukpu's parents in Providence.
He texted me and he said, Dad, you need to answer the phone. I think I'm in trouble. And I immediately knew.
Mukpu is in Liberia, where he's been working as a photographer, documenting the suffering from Ebola. He just signed on with NBC News Tuesday, teamed up with correspondent Dr. Nancy Snyderman. He felt sick Wednesday and testing confirmed Ebola Thursday. His parents have been talking to him regularly.
His spirits are better. You know, he's very scared. You know, he's just spent a month filming people dying from this disease, and it's impossible for him to lie there and not go there and not think about it.
Mukpu is now at a clinic and is set to be flown to a hospital in Nebraska Sunday.
We know that he's going to be much safer when he comes back and gets the correct medical care in the United States. But I think there's the honest fear that he becomes sicker before we have a chance to transport him.
Mukpu had spent 2 years in Liberia as an aid worker, came home this summer, but then went back when the Ebola crisis struck in hopes of making a difference. Mukpu wrote on his Facebook page last month, "I've seen some bad things in the last 2 weeks of my life, how unpredictable and fraught with danger life can be, how in some parts of the world basic levels of help and assistance that we take for granted completely don't exist for many people." And now he's among the sick there.
But overall, he feels that this was worth it for him to do, and he was doing the right thing. It's the nature of his life, and I doubt that it's the last time he's going to take this kind of risk, honestly.
And the Associated Press tonight, reporting on Mukpu's fascinating life, says that as a child he lived with his parents at a Buddhist community and was identified there as a reincarnated Tibetan spiritual leader. A fascinating life. The family later moved to Providence, where Mukpu went to Moses Brown. I'm Brian Crandall, NBC 10 News Night Team.
Thanks, Brian. Ashoka Mukpu was in Liberia when he was diagnosed, and with such a large Liberian community in our area, we wanted to know if Rhode Island Hospital is prepared. We spoke with Dr. Leonard Mermel tonight. He's medical director of the Department of Epidemiology and Infection Control.
We do see a large number of people coming through at any time of the year from Africa into our healthcare facility. So, you know, we're prepared for dealing with some of the exotic illnesses that sometimes people bring with them. The problem is someone that has these very general symptoms. The patient's not going to walk in with a sign on their forehead, "I have Ebola." They're going to come in with something that could suggest they've got the flu, they've got malaria. So it's that travel history, it's the epidemiologic link plus the symptoms. I have these general symptoms and I had traveled to a place where Ebola is spreading, that they then need to be taken out of a general environment in contact with other people in a waiting room of someone's office or a clinic or an emergency department and brought into one of these rooms where they can be isolated.
Meanwhile, health officials in Texas are now keeping an eye on 50 people related to their investigation. These are people who may have been exposed to the Ebola patient in Dallas. The number had been 100. Crews are now working to decontaminate the Dallas apartment where Thomas Duncan stayed before he was hospitalized. The family that lived there has been moved to a different home.
The White House tonight explaining how the government is responding to the Ebola crisis. The Secretary for Health and Human Services told us this tonight.
We're continuing to provide guidance for flight crews, emergency medical service units at airports, and Customs and Border Patrol officers about reporting ill travelers to the CDC. And we're continuing to work with hospitals and healthcare workers around the country to prepare most effectively, both in terms of detecting symptoms and then responding appropriately.
This story is moving fast, everyone. We're all